Good morning, everyone. My name is Hui-Ting. Today, my topic will be amylase and lipase test. I'll be talking about the description, PASO, amylase, lipase, and the procedure. So first, let's look at a case study. Mrs. Linda is a 44 years old lady who is usually fit and well. She came in one morning with a 2-hour history of epigastric pain, which came on very suddenly when she was ironing. She described it as very severe, sharp pain, which radiated through to her back. The pain eased slightly when she sat forward. She felt nausea with the pain and had vomited twice. Past medical history, she had a history of migraine and was not on any regular medication. She was a non-smoker and did not drink any alcohol. Her BMI was 22. Physical exam, she did not look well and was in pain. Her pulse was 88 per minute. Blood pressure is 120/72. And she was very tender in her epigastrium with mild rebound tenderness but no guarding. The lab test, her amylase level was 5,000 units per liter. An ultrasound, BRCP, and endoscopic ultrasound failed to demonstrate any gallstone. A CT abdomen was undertaken, which showed some delayed gastric emptying, and she was started on motilium, which improved her symptom. A hepatobiliary immunodiacetic acid scan was also performed, which shows reduced ejection fraction of her gallbladder of 25%. So she was referred to a cholecystectomy. For this case, this patient is having acute pancreatitis due to the gallstone. Gallstone is the underlying cause of the acute pancreatitis in around half of the cases, and around a quarter of the cases are related to alcohol abuse. Around 10% of the patients have idiopathic pancreatitis. Patients classically present with severe onset abdominal pain, which is usually associated with vomiting. The pain may radiate to the back, together with elevation of plasma concentration of the pancreatic enzymes, at least more than 3 times normal levels, are the cornerstone of the diagnosis. Other blood tests include liver function test, fasting blood lipid, and calcium concentration. Viral antibody titrate are often taken as well. It is increasingly common for an endoscopic ultrasound and magnetic resonance cholangiopancreatography to be undertaken if the first ultrasound examination is normal. Amylase and lipase are key digestive enzymes. Amylase help the body break down the starches, and lipase help the body digest the fat. Inflammation of the pancreas, also called pancreatitis, commonly cause high level of amylase and lipase in the bloodstream. The pancreas is a glandular organ that sits behind the stomach and produce digestive juice that empty into the small intestine. It has head, middle, and tail sections. Its head section connects to the first part of the small intestine. For the exocrine, pancreas makes, stores, and releases powerful enzymes to digest fat, protein, and carbohydrate in a small intestine. The enzymes normally are produced and carried in an inactive form to small intestine, where the enzymes are activated as needed. Exocrine tissue also make and release bicarbonate that neutralize stomach acid and allows for activation of pancreatic enzymes. For the endocrine part, pancreas produce hormones, including insulin and glucagon, and release them into the blood. These hormones regulate glucose transport into the body cells, where it is used for energy and to help maintain normal blood sugar level. Pancreatitis can occur when digestive enzymes become activated while still inside your pancreas, causing irritation and injury to pancreatic tissue and leading to inflammation. In acute pancreatitis, inflammation develops quickly and then goes away after a few days to weeks. The main cause is gallstones that block the pancreatic ducts and long-term alcohol abuse. Recurrent attack of acute pancreatitis can lead to chronic pancreatitis. Chronic pancreatitis is a long-lasting inflammation in the pancreas. Long-term alcohol abuse is the main cause. It can lead to the formation of scar tissue in the pancreas that keeps it from working properly. A pancreas that does not work properly can lead to digestive problems and diabetes. Symptoms of pancreatitis may include severe abdominal pain, back pain, fever, nausea, vomiting, and loss of appetite. Pancreatitis occurs more often in men than in women. The amylase normal finding is 30 to 100 units per liter. Some lab results go up to 140 units per liter. More than 3 times the upper limit of normal value indicates suspected pancreatitis. Indication: this test is used to detect and monitor the clinical course of pancreatitis. It is frequently ordered when a patient presents with acute abdominal pain. The serum amylase test, which is easy and rapidly performed, is most specific for pancreatitis. Amylase is normally secreted from pancreatic actin cell into the pancreatic duct and then into the duodenum. Once in the intestine, it aids in the catabolism of carbohydrate to their component simple sugar. Damage to pancreatic actin cell or obstruction of the pancreatic duct flow, as in pancreatic carcinoma or common bile duct gallstone, cause an outpouring of this enzyme into the intrapancreatic lymph system and then the free peritoneum. An abnormal rise in the serum level of the amylase occurs within 12 hours of the onset of disease. Because amylase is rapidly cleared 2 hours by the kidney. Serum level return to normal 48 to 72 hours after the initial insult. Persistent pancreatitis, duct obstruction, or pancreatic duct leak will cause persistent elevated amylase levels. Although serum amylase is a sensitive test for pancreatic disorder, it is not specific. Other non-pancreatic disorder can cause elevated amylase level in the serum as well. For example, during bowel perforation, intraluminal amylase leak into the free peritoneum and is picked up by the peritoneal blood vessel. This results in an elevated serum amylase level. And a penetrating peptic ulcer into the pancreas will also cause elevated amylase level. Duodenal obstruction can be associated with less significant elevation in amylase. Because salivary gland contains amylase, elevation can be expected in patients with parotitis, which is mumps. Amylase is also found in low level in the ovary and the skeletal muscle. Ectopic pregnancy and severe diabetic ketoacidosis are also associated with the high level of amylase. Patients with chronic pancreatic disorder that have resulted in pancreatic cell destruction or patients with massive hemorrhagic pancreatic necrosis often do not have high-level amylase because there may be so few pancreatic cells left to make amylase. Interfering factors. Serum Lipemia may factitiously decrease amylase level. Intravenous dextrose solution can lower amylase level and cause false negative result. Drugs that may cause increased serum amylase level include aminosalicylic acid, aspirin, corticosteroid, dextromethasone, glucocorticoid, mesodoba, narcotic, and oral contraceptive. Drugs may cause decreased level include citrus, glucose, and oxalate.
Yes.
Test result: increased level indicate acute pancreatitis, a blockage in the pancreas, pancreatic cancer, penetrating peptic ulcer into the pancreas, because the peptic ulcer penetrates the posterior wall of the duodenum into the pancreas. This causes a localized pancreatitis with elevated amylase level. Gastrointestinal disease. In patients with perforated peptic ulcer, necrotic bowel, perforated bowel, or duodenum obstruction, amylase can leak out of the gut and into the free peritoneal cavity. The amylase is picked up by the blood and the lymphatic of the peritoneum, where levels are demonstrated in excess. Acute cholecystitis, mumps, ruptured ectopic pregnancy, because amylase is also present in the salivary gland, gallbladder, and fallopian tubes. Disease affecting these organs will also be associated with elevated level of amylase. Renal failure, because amylase is cleared out by the kidney, so the renal disease will reduce the excretion of the amylase. Also, the diabetic ketoacidosis will have the elevated amylase level. Low level can indicate chronic pancreatitis. Chronic pancreatitis is most common, caused by heavy alcohol use, liver disease, and cystic fibrosis. Lipase. This test is used in the evaluation of pancreatic disease. Normal finding is 0 to 160 units per liter. 5 to 10 times the upper limit of normal value indicates suspected pancreatitis. The most common cause of an elevated serum lipase level is acute pancreatitis. Lipase is an enzyme to help break down the triglyceride into fatty acid. As with amylase, lipase appear in the bloodstream following damage to or disease affecting the pancreatic acinar cells. Because lipase are thought to be produced only in the pancreas, elevated serum level were considered to be specific to pathologic pancreatic condition. Lipase is excreted through the kidney, therefore elevated lipase level are often found in patients with renal failure. Intestinal infarction or obstruction also can be associated with lipase elevation. However, the lipase elevation in non-pancreatic disease are less than 3 times the upper limit of normal as compared with pancreatitis, in which they're often 5 to 10 times. Other conditions such as cholangitis, mumps, cholecystitis, or peptic ulcer are rarely associated with elevated lipase level. In acute pancreatitis, elevated lipase level usually parallel with serum amylase level. The lipase level usually rises a little later than amylase level, which is 24 to 48 hours after the onset of pancreatitis, and remain elevated for 5 to 7 days. Drugs that may cause increased lipase level include cholinergic, codeine, indomethacin, meperidine, morphine, besenacol. Drugs that may cause decreased lipase level is calcium ions. Test result: Increased level of lipase indicate pancreatic disease such as acute pancreatitis, chronic relapsing pancreatitis, pancreatic cancer, pancreatic pseudocyst, biliary disease such as acute cholecystitis, cholangitis, extrahepatic duct obstruction. Although this doesn't commonly happen and the pathophysiology of this observation is not very well understood, it is suspected that lipase exists inside the cell of the hepatobiliary system. Disease or injury of this tissue would cause the lipase to leak into the bloodstream and cause levels to be elevated. Renal failure. Because lipase is excreted by the kidney, if the excretion is poor, as in renal failure, lipase level will rise. Intestinal disease such as bowel obstruction and infection. Because lipase exists in the mucosa cell lining the duodenum, injuries through the obstruction or ischemia will cause the cell to lyse. Then lipase will leak into the bloodstream and cause levels to be elevated. Salivary gland inflammation or tumor. Like amylase, salivary gland contains lipase, although to a very much lesser degree. Tumors, inflammations, or obstructions of the salivary duct will cause the cell to lyse. The lipase will leak into the bloodstream and cause levels to be elevated. Low levels happen when there is damage to cells in the pancreas that make lipase in certain chronic disease such as cystic fibrosis. Also, certain medications, including codeine and some birth control pills, can also lower the lipase level. So let's compare the amylase versus lipase. The lipase peak later and remain elevated longer than the serum amylase level. Serum lipase level is more useful in the late diagnosis of acute pancreatitis. Lipase level are less useful in more chronic pancreatic disease such as chronic pancreatitis, pancreatic carcinoma. Lipase test has more sensitivity and specificity, hence it is a better option. Level of lipase are not correlative of severity of the disease, which means if a patient have a very high level of lipase, doesn't mean the disease is very, very severe. Due to American Society for Clinical Pathology, do not test for amylase in case of suspected acute pancreatitis. Instead, test for lipase. Current guidelines and recommendations indicate that lipase should be preferred over total and pancreatitic amylase for the initial diagnosis of acute pancreatitis, and that assessment should not be repeated over time to monitor disease prognosis. Repeat testing should be considered only when the patient has signs and symptoms of persisting pancreatic or peripancreatic inflammation, blockage of the pancreatic duct, or development of a pseudocyst. Testing both amylase and lipase is generally discouraged because it increased cost while only marginally improved diagnostic efficiency compared to either marker alone. Serum lipase is now the preferred test due to its improved sensitivity, particularly in alcohol-induced pancreatitis. Its prolonged elevation creates a wider diagnostic window than amylase. In acute pancreatitis, amylase can rise rapidly within 3 to 6 hours of the onset of symptoms and may remain elevated for up to 5 days. Lipase, however, usually peak at 24 hours with serum concentration remaining elevated for 8 to 14 days. It means it's far more useful than amylase when the clinical presentation or testing has been delayed for more than 24 hours. On the procedural and patient care, it is not too much to concern. Only collect the venous blood sample For the amylase, avoid alcohol for 24 hours before the test. So for the blood draw, do not eat or drink anything other than water for 2 hours. For the lipase, we have to instruct the patient remain on MPO status except for water for 8 to 12 hours before the test. Okay, let's go back to our case study. Patient Linda had a laparoscopic cholecystectomy and has since been symptom-free and is no longer taking mutilium. The management. Patient need to be admitted to hospital and have intravenous fluid, oxygen, and analgesia. There is some evidence that early oxygen supplement and fluid resuscitation is associated with resolution of organ failure, but there's no specific drug treatment for the management of acute pancreatitis. For the complication and the prognosis, infection of necrosis is the most serious local complication of acute pancreatitis and is associated with mortality rate of around 40%. Paralytic ileus is very common in the first few days of developing acute pancreatitis. Many patients gradually increase their oral intake as their symptoms improve. Here are the ICD-10 coding related to pancreatitis for the purpose of reimbursement. Lastly, here are my references. Thank you.